So we are now recording, FYI. Okay, next slide. Alrighty, so here is our agenda for our partnership meeting today. We want to give you all some updates on what we've been doing. RHSE stands for Rural Health and Safety Education. It's the funding source, the primary funding source for the past several months on what we've been doing with the ROPTA project. So we want to give you some updates there, but luckily we also have a couple new sources of funding that are helping us continue to expand and maintain our current reach of programming. So we'll be describing to you exactly what our new funding allows us to continue doing, as well as some new projects that we may be able to get into. We'll follow that up with kind of a review of the accomplishments of the grant over the past few years in total. We will have a partner spotlight of the Garrett County Community Health Department, where we have a presentation about their current harm reduction efforts. And then we will finish up with a discussion in regional breakout rooms on some priorities for addressing the substance use crisis in the state. So we have a packed agenda. We are going to fill it up in the next hour. So, all right. So we're going to begin with some updates from the Rural Health and Safety Education Grant. So if you all were at our September partnership meeting, you might have learned that our one funding stream ended that allowed us to do programming pretty much in any rural area around the state. Since September, the funding that we have had has caused us to focus on the green highlighted counties here. They are federally designated certain codes. The government uses a code of, and it's different depending on the agency too. I believe it's the, don't quote me on this, I believe it's the census, but I think like HRSA uses a different code. Anyway, it's very restrictive. And so we have only been able to provide direct programming to these counties, or for people who at least work in these counties, even if you don't reside there. Next slide. So even though our geographic range has been somewhat limited, we have found ways to offer programming in other areas, but these are the programs that we've been offering: mental health first aid, instructor training as well. ROR stands for Regrounding Our Response, which is a Maryland Department of Health series on harm reduction and stigma reduction around substance use. Overdose Lifeline provides a similar content, but targeted more towards the general public, whereas ROR is kind of targeting advocacy and policy. TNAD is This Is Not About Drugs, and it's a youth-focused presentation. And we've also had other special topics throughout the past throughout the past 6 months and during the duration of this particular program. Next slide.
Yeah, thanks, Alex. So we wanted to take a moment to highlight some of the progress that we've made towards reaching our RHSE grant objectives. We have surpassed our mental health first aid goals, where we propose to offer 20 sessions and reach 200 participants. Thus far, we have completed 23 sessions, which is 115% of our session goal. And that has resulted in us reaching 237 certified mental health first aiders, which is 119% of our participant goal. We are also making some progress towards our mental health first aid instructor training goals. We have currently hosted 9 mental health first aid instructors, which is 30% of our 30 participant goal. However, we do have an upcoming training in the beginning of March, where we are expected to host an additional 16 mental health first aid instructors, which will result in us reaching 83% of our participant goal. We've also had a lot of exciting progress with the Regrounding Our Response series and Overdose Lifeline courses. We have currently completed 18 sessions, which is 72% of our 25 session goal. And that has resulted in us reaching 256 participants, which is 51.2% of our 500 participant goal. And we are engaged in various collaborative series, which are contributing to us reaching these ROR and ODL goals. And just to highlight two of those collaborations here, we are working with the Garrett County Community Action Committee, where we are offering 2 ODL courses, including opioid public health crisis and removing the shame and stigma of substance use disorder, as well as offering all 5 courses in the ROR series. And then we are also working with the Worcester County Health Department to offer all 5 courses in the Regrounding Our Response series. Then we also just wanted to take a moment to highlight some of the survey data that we've received from participants. So when asked what their primary professions were, the highest number of participants responded social work, the second highest number of participants answered peer professionals, and the third highest number of participants answered community health workers. And then when asked what their principal employment setting were, the highest number of participants answered community-based organizations, including faith-based organizations. The second highest number of participants stated that they worked in community health, and the third highest number of participants responded mental health clinics or treatment programs, including community mental health programs. And then when asked how satisfied they were with the overall quality of the event that they attended, 95% of participants stated that they were satisfied or very satisfied. Then when given the statement, I expect this event to benefit my professional development or practice, 97% of participants agreed or strongly agreed. Additionally, when given the statement, I will use this information from the event to change my current practice, 83% of participants agreed or strongly agreed. And then lastly, when asked if they would recommend the event to a colleague, 98% of participants stated yes.
So we do have some new funding streams available now. So like I said, the results that we've just reported were tied to the 5 counties that we were allowed to target in our with the funding that we've had through now. But in the past few months, we have received 2 new grants. So one is the ROTA regional grant. So you formerly knew us as MarylandROPTA, and now the federal government transitioned that to a regional model. And then we also received another SAMHSA grant, which is in their the MHAT, or the Mental Health Awareness Training grant, which we'll talk about both of these and what we're able to do with them. So, Ali, did you want to share about the ROTA-R grant objectives?
Sure. So as Alex mentioned, we're very excited. We always, navigating these grant cycles type of thing, and then different organizations. So we're always trying to look for opportunities to strengthen our services, especially for rural communities. So these regional grants, like Alex mentioned, SAMHSA moved from a specific organization to regional. And so we're part of this new region that includes Penn State, West Virginia, the state of Delaware, and ourselves. So we competed. It was a competitive grant as a regional grant, and we got this, and the lead organization is Pennsylvania. And so this is a 2-year grant that aims to provide supports and resources to rural communities. But the definition of rural is a little bit more flexible than compared the other grant that we were just discussing, the RHSE. So with this grant, we'll have more latitude to work and serve different counties in our state. So this is some of the things we promised we're going to do with the grant, including continue to do these web-based modules about interventions and prevention science. These are already developed by Penn State for other purposes that they're sort of disseminating, and we're part of that strategy. So we plan to offer these, open these opportunities for the organizations and these collaborative. And also to conduct live webinars for a specific underrepresented audience, underserved populations in our state. We are trying to identify the topic. I know Alex has been identifying the interest of our communities, and to be, I think, related to regrounding our response, maybe one of the topics. But anyway, we're customize some training here for our Maryland population, and then to continue strengthen our mental health first aid due to the large demand and the great opportunity. So we want to continue to provide these mental health first aid training services to other counties and other providers. So we have resources to do that.
Great. Yes. So I think you all saw the chart that we're at like over 100% of our mental health first aid goal for the rural health and safety. And, given that a grant only budgets so much money for certain objectives, we were so happy to get additional funding to keep doing mental health first aid and do it in a lot more places than just the 5 federally designated rural counties. So for those of you in other parts of the state besides Garrett, Kent, Dorchester, Caroline, and Talbot, you should jump for joy because we want to keep delivering to you all, and now we have the funding to do so as well. So the second grant that we received is also from SAMHSA, and we are the prime recipient this time, and that is the Mental Health Awareness Training Grant, which is also focused on mental health first aid and additional instructor training opportunities, because we know that, as much as we like doing the mental health first aid training ourselves, it's better if we can even provide the opportunity for you all to be certified instructors yourselves. And bring this training to your communities. So we have the fund that this grant is, it's a 4-year grant, although it's done in 2-year chunks. So basically, if we do a good job the first 2 years, then they give us the next 2 years. So, and we do have instructor training funds for 1 training per year to train 16 individuals to become their own certified mental health first aid instructors. So you wouldn't have to wait for us to offer the mental health first aid training. You could be the ones to offer it in your own communities on your schedule. However, we continue to be very much interested in partnering with you all to deliver these trainings. Another big component of this grant is that we are trying to establish referral mechanisms to treatment providers, and that's not just therapy, but any kinds of services related to mental health. So a lot of you offer those types of wraparound services, whether it's direct counseling and therapy, or peer recovery services, or support groups, or other types of informational resources. So that's what makes this grant a little different. We're not just doing mental health first aid, we're also tracking and trying to develop the connections in the community between the people who take mental health first aid and service providers. So that is something that I'm actually looking for all of your interest in. If you are interested in being a referral source, is that the right word, a referral destination for people that take mental health first aid to give to people that they assist, then please let me know. Because the idea is that when you take mental health first aid, part of your training is what are the resources in my area, and can I give those to the people that I'm assisting? So we do talk about that when we do mental health first aid, but this grant is specifically funding like developing and making those connections even tighter, so that when you walk away from the mental health first aid training, you really have that local list of referral sources. So that if I'm walking around as a mental health first aider in St. Mary's County or Talbot County or Caroline County, I know that if I encounter somebody on the street who needs services, I have a locally relevant list of resources in various categories, not just therapy, but various categories. And part of our mission from SAMHSA for this grant is to track how many referrals people actually make. So it's a really interesting way of trying to increase community engagement on this issue. So if you're interested in having your agency be one of the referrals, please let me know, because we will need to get you on the list and get you in the right region of where you can accept people as referrals and what type of services you provide. Okay. So is this still me?
Take over if you want to break. Awesome. Well, hello, everybody. I'm Julie Slivka. I'm a community educator with MarylandROPTA. I also kind of do a lot of the work behind the scenes for the marketing and the social media and the website. So I wanted to just give you a couple more highlights on some of our accomplishments for 2022, as well as our years 1 through 3. So you might have seen this little infographic floating around the internet some places, but I just really like to highlight some of the qualitative and quantitative data that we have gleaned from all of our work. So over the years 1 through 3, we had almost 9,000 total course participants. As Emma notated, about 94% of them would recommend our trainings and events to colleagues, and 80% agreed that it will benefit their professional development and or practice. So some of the most notable things, we were able to train over 900 mental health first aiders, 65 were instructor certified through us. We had about 1,112 youth participants. This was through Botfin life skills training. TNAD, this is not about drugs training, and all of our youth-centered, youth-focused programs. We had over 118 community partners throughout Maryland. We're always looking for more partners. We see a lot of our wonderful partners here, and we're so grateful for our partners because they allow us to make this work possible. We were able to certify 13 Botfin life skills instructors. We're still hoping to be able to certify more individuals to empower our communities to offer that really great evidence-based Botfin life skills training in their communities. And then we had almost 6,000 training and webinar participants. So just a couple of the things that people say, it's very valuable information. It really changes how they think about things, it changes their perspective, how they respond to it. A lot of our trainings, we hear that a lot, you know, when people leave, they say they have actionable steps that they can actually implement that day. And that is really what we're trying to do. We have amazing instructors on staff. You're seeing a lot of them right now, Stephanie being one of them. And we just really look forward to, you know, working with the community. We love hosting public events, but we also really value working individually with our partners to host webinars and trainings in person or virtual, specifically through the organization, through specific communities, to really address the unique needs of each one of our communities. All right, so a little bit about our social media reach from last year, 2022. Facebook, we saw a 155% growth in page reach, as well as 27% and 32% in likes and followers respectively. We actually utilized less ad spend. So we did less Facebook ad spend on advertising, and we still actually reached a decent amount of people. So that was really great news. We're really growing our reach on Facebook. Instagram, we had an 18% increase in followers. We're really excited about that. We're really trying to capitalize on the markets that are working for the people we're reaching. We know that Facebook and Instagram, those markets are constantly evolving. So we're trying to implement new strategies. Next slide. So for our newsletter, a newsletter is actually a very strong arm of our reach and how we are able to communicate everything we're doing to our partners. So last year, at the end of the year, we ended with over 4,000 subscribers, which is awesome. That was a 186% increase over 2021. We're averaging about 20% above industry average, with a 4% above industry average open rate at about 50%. So let's see here. Yeah, about 58% of people who open up our newsletters actually do click through. And we are seeing, like I said, an increase in 82% in sends and 81% open. So really great there on our website. Because we did recently change, you know, we used to be ROTA, now we're ROPTA. We had to kind of transfer our website. We had to transition over into MarylandROPTA.org. So through this, we've really been trying to enhance and update a lot of our content and everything that we're posting. So we saw an increase in 11% in visitors, 10% increase in sessions. So we're doing really, really great there. We reached about a little over 12,000 people through our website in 2022. YouTube, definitely check us out on YouTube. We're still trying to grow that. We have some amazing interns who are working very hard on creating compelling content for YouTube, but we did see a very substantial increase, over 1,500% in impressions, 60% in views over 2021. And then our Eventbrite, that's going to be the tool that we use to post and reach people for a lot of our webinars and trainings that we do. So we saw almost a 10% increase in registrations. So altogether for 2022, our social media reach was over 60,604. So we're really excited about that. We're looking forward to continuing to grow. We definitely always appreciate when our wonderful partners such as yourselves share what we're doing. You know, we're always big on cross-promoting and cross-pollinating and reaching as many people who would benefit from our services as possible. So thank you guys all again for what you do, and thank you for allowing us to do what we do. Oh, I can go through this, sorry. A little premature there. So I will actually put our programming packet into the chat here in just a minute. It just has a couple of these. So as you know, we have 4 main areas that we do. We do mental health first aid. We have the overdose lifeline series. We do Generation RX, and then we do Botfin life skills, and we're grounding our response. So we have all of these really great infographics. Please feel free to take them, disseminate them virtually, or we can get them printed out and shipped to you, whatever is going to get this information out into the community. Again, all of our trainings are everyone's favorite price of free. So the more people we can get on board, the better.
Okay, so I also wanted to share a couple publications that we've had recently. So one was in the journal, the National Extension Association of Family and Consumer Sciences Journal. So we posted a study on our experience with implementing Botfin life skills and how that played out in a high school in, or several high schools and middle schools in Allegheny County. So we reported on our results there. And the takeaway was that, the content is pretty good. Some of the youth had mixed responses to the material depending on their, how basic the material was. The experience was that some of the material in Botfin may be like kind of already known by youth in terms of risks and what is involved with drug use, but it is a evidence-based curriculum, and so we just wanted to present our experience with that. So that's available. Next. We also just published a fact sheet that is peer-reviewed through our University of Maryland Extension process on stigma, and this is not about societal stigma, it's actually about internalizing stigma about mental health issues. So this fact sheet also provides some tips and strategies on managing internalized stigma so that you're not delaying your own health care when it comes to mental health. All right, and with that, we will let our partner, the Garrett County Health Department, take the lead here, and I will allow screen sharing now for, I believe, is Sandy here?
Alex, I
Okay.
sent the PowerPoint. Sandy wanted you guys to advance the
Okay,
slides. She
great,
has some
we got it.
difficulty with that,
We
please.
got it. Yeah, we'll pull it up.
Thank you, Alex. Can you hear me okay?
Yes, we can hear you. Thank you for agreeing to share what you're doing in this world as our partner.
Yes, you bet. Good job, ROPTA. A lot of good stuff happening there. The Garrett County Health Department hosted a mental health first aid last Friday with Jesse Ketterman. He did a great job. I think there were like 15 to 20, something like that in the group. So it was great.
Great.
All right, so I was asked to share some of what we do at the health department with prevention services. We are located in health education and outreach department here at the health department. I know a lot of prevention services throughout the state are with their behavioral health agencies, but we have our own little prevention department. We have program administrators. There are prevention coordinators, prevention specialists, and community health outreach workers within our unit. And we're able to provide, prevention services throughout the whole county, which consists of about 28,000 people. We currently have funding sources through the Maryland Department of Health and also through CDC and SAMHSA. We have the Substance Abuse Block Grant, the Opioid Misuse Prevention Program Grant, the CARA Grant, which is the Comprehensive Addiction and Recovery Act, and then the Sober Truth on Prevention of Underage Drinking Act grant. So a lot of what we do in our department is primary prevention, universal prevention, trying to prevent that first use of a substance. We have a lot with harm reduction, with the overdose prevention, overdose deaths prevention. Most of what I'm going to talk about today, though, is primary prevention and the universal target population that we reach throughout with our programs. So you can go ahead and advance. So what I want to share today is some of our YRBS data. I want to share, what we're doing currently with the Substance Use Block Grant and the Opioid Misuse Prevention Program Grant, and also some of what we do through our different community education with all of our providers and sectors within the county. When you look at the YRBS data in Garrett County, when you compare most of the data with the state of Maryland, you can always see where our rates are usually significantly higher than the state of Maryland. Of course, we are rural. We have a lot of intergenerational poverty, intergenerational drug use, and not a lot for the youth to do in a lot of different capacities. So when we write grants, a lot of times I feel like get those because it's based upon our data. Would rather have good data, less drug use. I wish our numbers would be a lot better and we wouldn't even need the grants, but I feel like get a lot because we do have a significant amount of drug use among our youth. So cigarette past 30-day use here, you can see where, the use is declining, it's decreasing through the years, but we still have a much higher cigarette use than the state. Advance. Same thing with vaping. I think everyone's seeing this throughout the nation. A lot of times we're seeing the tobacco use with cigarettes and smokeless tobacco. Those are decreasing, but we know that our vaping rates are really increasing a lot. And just among our 12th graders, 22% vape daily. And this is, I should have said 2018 data that I'm sharing here right now. And with the 9th grade, 2.8% vape daily. So with our whole high school, 12% of our high schools, we have 2 high schools, Southern and Northern, and the rate among them is about 12% that daily vape. Advance. Alcohol use past 30-day, it's been so high, through the years. We are happy to see that trend going down and the numbers are decreasing, but once again, our rates are much higher than the state. So we continue to work with all we can with alcohol. We see a lot of the grants that have went towards opioid, misuse, prevention, treatment, and recovery. And we definitely understand that, but we always say that we cannot forget about the other substances, especially when it comes to prevention among our youth, because we still see a lot of our youth that are, partaking of the alcohol within our county. Advance. Binge drinking past 30 days, we're 20%, once again, decline, decrease, but still higher than the state. Advance. Marijuana use, looks like we're pretty well neck to neck here with the state of Maryland. I think we all sort of feel like that we're going to see this number increasing in the future. I think the YRBS data should be out any day now for 2021. So we're really looking forward to getting that data and to be able to access that data and see what some of the uses with marijuana, especially now that we're seeing legalization and things like that throughout the state of Maryland and really throughout the country as we move forward with that. Advance. Prescription drug misuse, a little bit higher than the state here, about 16.5%. I know a lot about what you all do with ROPTA is about opioid misuse and prevention and treatment. So you see our numbers here. It's about 16.5% among our high school youth who are using prescription drug and misusing that drug. Continue. Heroin, 5.6%. It's always alarming to think that we are higher than the whole state of Maryland, but you know, it's been that way for many years. And a lot of people, even when we share this locally, they'll say, that's not right. Our kids are just lying. And, you know, they're just saying this just to be cool, whatever. And we say, well, if they did that, then they pretty much did it throughout the years. So the data still is very consistent. So continue. Methamphetamines. Methamphetamines, as most people know in the state, it's a rural Western Maryland issue. We see the numbers of use and even the overdoses that are happening throughout the state. We see it in Western Maryland, especially Garrett County. Those numbers are much higher than the rest of the state. Continue. Okay, I just want to share a little bit. I talked about, you know, some of the grants that we have, and the two of the grants that we have, Substance Abuse Block Grant and the Opioid Misuse Prevention Program grants, are through Maryland Department of Health, the Office of Population Health Improvement. And I just want to share a little bit about those strategies and activities that we are implementing this year and throughout 2024. Continue. Everything that we have done through our Maryland Department of Health grants have been based upon a strategic prevention framework. It just outlines the process that any organization, community, or state can follow to try to prevent and reduce the use of alcohol, tobacco, and drugs. And I'm always saying, I always have to admit this, and I'm sure the state, if anyone's on this call, that they probably will chuckle, but you know, when we first went through this process years ago, we used to run prevention where we looked at an activity, we thought, oh, this looks like it would be good, you know, we want to try it, we want to use it, whether it be in the schools, in the community, work sites, wherever. And, you know, then the state really started looking at evidence-based programs and how we really needed to follow some type of model where we could really see more success and positive outcomes with our data and our programs. So that's when they come out with the Maryland Strategic Prevention Framework, which goes through the assessment, capacity planning, implementation, and evaluation of all programs. And have to say, I am definitely a believer. I really do believe that if you can go through this process and you continue this will, and it's just an ongoing process, that you can see where a lot of what's happening in a county, community, or any program, you're going to see that it's more effective and promising as far as the evidence-based programs that you implement, because once you go through this process, you see that those are the programs that are specifically what your community needs based upon the data. And, you know, the biggest part of this, or a very big part of this, is the assessment, the data collection, and how that's ongoing. And when we see a lot of our numbers coming down with our drug use with our underage youth in the county, we really can see and can attribute that a lot to this process and this model. Continue. So one of the strategies that we use is the community-based process. This is an ongoing networking activity and technical assistance to community groups or agencies. It encompasses neighborhood, grassroots, empowerment models using action planning and collaboration systems. Continue. So some of the things that we do with the community-based process is we follow a plan, and we follow that plan because we want to see outcomes, and we want to see good outcomes, and we want to see us measure our goals, and we want to see everything that we do within our strategy come about to where the community sees and understands and sees the positive result of that. We want to improve the ability of communities to provide more effective prevention, treatment, and recovery strategies. I have to say, through a lot of what we've done through the years with harm reduction strategies, and we had the Rural Community Opioid Response Program Implementation Grant for 3 years that really brought our division a lot closer to the behavioral health division, where there's treatment and recovery services. And we see where we're really working a lot more with them hand in hand with a lot of what they're doing. So it's not like prevention is on this side of the building and treatment and recovery is on the other side. We've really unified to where we can make this community-based process look a lot more positive and focused as far as when we move forward with any type of strategy. Advance. So one of the first things with anything with the community-based processes is that you want to have your key partners and you want to have those people at the table. And we do a lot of that through our coalition. We have a Drug-Free Communities Coalition. We have the Stand Together Garrett County Against Drug Abuse Coalition. A lot of the community partners that we work with are part of those, but not all of them. When it comes to local government, a lot of the county government, they might not sit at the table. So we have to get out where the rubber meets the road and be able to educate and give them information about what we're doing with prevention services in our county. Continue. Collaboration is definitely the key. I just can share an example of this, that just recently, through this grant and through the strategy, we were able to meet with the mayor and town council of one of our municipalities. And it was a very positive encounter. He really wanted to work with us. He allowed us to start a community planning group there. That's a grassroots organization who works in the community, provides alternative activities, education and resources to their community members with prevention, treatment, and recovery. And through this partnership and through the community planning group, this Friday, we're hosting what we call a prevention education fair. So we're bringing different agencies within the county to the table together to be able to provide information and resources about all the prevention and treatment and their agency services within the county. And it started out as just a few, and just as the word got out, well, I think we're up to almost 20 booths probably of people that want to come and be part of this evening with us. So of course we have to have fun things for the kids to do. So we have some prevention games that we're going to play with them to provide the prevention and education, to be able to just make it an all-around good event, to be able to really hone in on this community. And this community we did the data with. We looked at some of our overdose data, the ALICE data, some of the poverty data within the state or the county, and we really saw where this is a county which really needed more intense prevention, treatment, and recovery services. Next. We want to develop actionable goals. I mean, that's one of the most important things that we do based upon the data. We want to be able to improve and sustain outcomes and processes. That's the main objective and what we want to do, and to identify areas to focus on, which is what we do through this whole strategic prevention planning process. Next. Assessments, as I said before, we continue. We've been updating our countywide needs assessment for substance use, and we've been doing a series of key informant interviews with our agency partners, focus groups. We've been able to do them with some of our young people in the county, with our college students, with a treatment and recovery group. So we're able to take all that data, put it together, and conduct a really great needs assessment within the county. And as our grantors say, it's an ongoing process. Assessment, it doesn't stop with a needs assessment. You continue to get the data, you continue to hone in on exactly where the services need to be and the populations that you really need to address. Next. So implementation and evaluation, pretty much said that already. We want to evaluate the impact of any program, schedule meetings, talk about that, identify new programs to fill gaps. And one of the most important things that we really like to do is anytime we have data, which is a lot anymore, we share that with all of our partners. We let them know, this is what our data looks like, and this is where we're moving forward in the future. We want to get their input, because a lot of times the people that sit at the table are the ones that can have really good ideas on how we can help fill those gaps within our programs. Next. How much time do I have? Because I feel like I don't want to take too long here. I could sort of scan through some of this quickly.
So we were shooting for 15 minutes and
Okay, I better be moving on
Yeah.
then, Alex. Okay, so once again, community-based processes, we came up with a program that we call Communities Together. And we want to address community attitude and beliefs favorable to youth alcohol use and non-medical use of prescription drugs. Those are the two drugs that we really are focusing on currently with the funds that we have within this grant. You can go ahead and move on. So I sort of talked a lot about that as I've talked about, one thing that I didn't share though is we do try to provide training to not only our coalition, but also to our community volunteers that we have working with us under the community planning group model. And we just feel like training is so important because it helps keep our partners abreast to, new trends that's coming out and anything new that's happening within our grants. And we've did a lot of stigma training within our county, and we just continue to do, training just because we know that it really helps bring the table together with understanding what we're doing in prevention. Continue. I'm going to just go ahead and go through there because I sort of talked about our community champions in the towns that we've talked with the Mayor and Town Council. And I think when we talk about community champions, we really want to let people know how important their presence is in the community and what they're already doing as far as positive prevention efforts, and to thank them. I know, like at our event this Friday night, we're going to allow the one of the town council meetings to get up and talk a little bit about what we've been doing in our community and the prevention things that's already happened in their community as far as activities and things that families can do. Continue. We're going to host a couple of underage drinking prevention town halls in the future, and definitely try to get invitations out to churches, businesses, nonprofits, schools. And we know that anytime we do anything, media and marketing promotion is really an important part of that. Continue. Already mentioned the community health fair, so you can go through this one. Social marketing campaign. We have a campaign currently. It's called Store, Monitor, and Secure What's in Your Cabinet. It's about proper storage and monitoring of alcohol and prescription drugs. I know we do a lot about talking about prescription drug, proper storage, monitoring, and storing prescription drugs, but we know that it's also important to do the same thing with alcohol, because we know that our youth get the alcohol in the cabinets or in the refrigerator just like they do the prescription drugs. So it's a campaign that pretty much encompasses all of those things with proper storage and monitoring. Continue. Just go ahead and go through. I don't need to go through all the details of it. We do provide funds to our Healthy Families program. It's to be able to address those families that are lacking parenting skills and practice in developing, discussing, and enforcing family policies, especially on substance use and specifically on prescription drugs and alcohol. So we're very happy with that because we know that primary prevention, the earlier we can start with that, the better. So this is really an intensive in-home program with family support workers and nurses that work directly with these families, sometimes twice a week, sometimes weekly, eventually monthly, but they're really there educating and providing the skills and resources that families need in the county. Continue. Go ahead and go through. Medication storage and disposal. Sadie, do you want to talk a little bit about this? The last two are yours.
Oh, okay. I'm on my phone, so just some of the things that we do with that: environmental, and then I do a lot with medication storage and disposal. I'm going to be having a big campaign coming up in the next 2 months with that. This focuses on adults and proper and safe storage and disposal, plus the location of the 3 medication drop boxes. This is for non-medical use of prescription drugs. So go ahead. Academic detailing is something else that I do. We do academic detailing with pharmacies. That's what I do. My coworker, Chelsea Dever, does academic detailing with physicians. What I do when I go in, I talk about the standing order for naloxone. So if a doctor doesn't prescribe naloxone for someone who has an opioid prescription, hopefully the pharmacy will catch it. So I talk about the standing order that they can use to do that. Also talk a lot about just having that conversation with clients about, are they storing their medicines and how addictive that they can become. I give doTERRA pouches to the pharmacies as well when I go in and talk to them with academic detailing. So, okay, next one. Okay. Sandy, you're up.
Yeah, go ahead, Alex. I just wanted to share some of the different community education that we do. You can advance. Just to talk a little bit about the schools. We go in and do 9th grade health classes. We offer drug prevention education each semester on underage drinking, non-medical use of prescription drugs, and tobacco use and misuse. We have youth in action teams at all 4 of our schools. We have 2 middle schools and 2 high schools, and the youth in action teams are really the same as the SAD chapters. So they do the same thing, the peer-to-peer education amongst their peers at their schools. At elementary schools, we get up on request to do any type of prevention information. We have elementary schools right now that are in the process of doing some health education fairs, so they've invited us to be there. We will want to wrap up so we can do a breakout room. So Alex is saying we need to go ahead and wrap. So sorry that I couldn't finish it all, but we do definitely do a lot within our county, within, you know, the different venues and the different types of partners that we have are just numerous. And a lot of that is because we have a great community health outreach team, and they're always out there in their communities. They know their churches, their work sites, their schools, and they're able to really promote whatever type of messaging that we want to do throughout our department. So honestly, we couldn't do it without the team that we have. We have a great prevention team. We have a great harm reduction team now. And we're certainly happy to talk about that harm reduction in the future. And we will be very careful to stay within our 15 minutes. So thank you guys very much. We appreciate your time to share today.
Thank you for sharing. And it's really inspirational what you all are doing in Garrett County. And I hope that the folks who are listening can take away some of your process. I really appreciated that model of how you go through the community engagement process. So I think that's a really great way of organizing your efforts for health outreach. So for the last 10 minutes, we're going to be doing a breakout discussion in our regional rooms. We'll have less than 10 minutes. We're going to maximize our time here. We're going to go, I think now we're going to go for about 5 to 6 minutes for a real quick brainstorm on bringing our resources to youth populations, because it's my read that the next round of funding from the government on this issue will have a youth focus, especially given what's happened in the past few years with the pandemic. So what you now have the option to do is to select yourself into a breakout room. So there we have Eastern Shore, Western Maryland, Southern Maryland, and Central Maryland, and we will have a facilitator from our team in each area. Everyone, all of our ROPTA team members, we're going to bring it back at 9:58 so we can finish up the last 2, just wrap up and say bye to everyone after our brainstorm on reaching youth audiences in your communities. All right, so go ahead and assign yourself into join the appropriate breakout room for where you're from, and we'll have a few minutes of discussion on ideas for reaching youth populations. And our ROPTA team, if you can join, can we have maybe Julie, can you join Eastern Shore? Stephanie, can you join the Western to start facilitating that?
Yeah.
All right, we only have one person. So If you're unfamiliar with the breakout rooms, there is a little tab at the bottom of your screen where you can join a breakout room. And you would go to the one that's specific to your location. All right, I'll pop into the Central Maryland one. Can we recall everyone? It sounds like people are probably still chatting.
Yeah, though they should be those breakout rooms should be closing very shortly.
Okay, yeah. It's probably just means that there was good discussion.
Great.
We had the tiny one. We had the Central Maryland, not a lot of folks, but we'll grow our partnerships in that area.
That was so fast, guys.
I know, we just, yeah, it's hard to fit in enough into just 1 hour. Maybe in the future we can extend the meeting or have a different time for brainstorming. But I really appreciate everyone's engagement in and participation today. I hope that you were inspired to continue your partnership and staying tuned in to what we're doing at MarylandROPTA. I also hope that our partner spotlight gave you some ideas on how to do really great community outreach. And please feel free to contact each other. If one thing that we can do is, we can share at least what was in the chat box, so that if you didn't get somebody's name, we'll have it and we can facilitate introductions. Yeah, so that's we have the chat box. And so that we're not like sharing people's information too broadly, we'll share at least the attendees' names, and then you can ask us to facilitate the intros if you can't find each other on your own. So we'll be happy to do that. Okay, well, thanks everyone for attending. And I'm going to end the recording here.